What is submuscular placement for Saline implants? Imagine giving your breasts a more natural look and feel. That's what submuscular placement aims to do by positioning the Saline implant beneath the chest muscle, specifically the pectoralis major. Instead of sitting directly behind the breast tissue, the implant is tucked under both the muscle and the natural tissue, sitting between the muscle and the ribs. This technique offers several benefits. Because the implant is covered by muscle and tissue, it tends to look softer and more natural, especially for women with less natural breast tissue. The muscle acts as a smooth cover, reducing the chances of the implant edges being visible or feeling palpable. This is particularly helpful with Saline implants, which are more prone to rippling or wrinkling. The muscle layer also helps mask these ripples, making the results look more seamless. Another advantage is that placing the implant under the muscle can lower the risk of capsular contracture. This is a complication where scar tissue tightens around the implant, causing firmness or distortion. Studies have shown that submuscular placement can reduce this risk compared to placing the implant above the muscle. Additionally, implants under the muscle interfere less with mammogram imaging, making breast cancer screenings clearer and more accurate. The added support from the muscle can also help keep the implant in place over time, reducing the chance of displacement or sagging. However, there are some considerations. Because the surgeon lifts and stretches the muscle during surgery, recovery can be longer and more uncomfortable. Patients often experience more postoperative pain and need more time to heal. When the pectoral muscle contracts, it can temporarily change the shape or position of the implant, which some women notice during muscle movement. The procedure itself can be more technically complex, often taking longer than other placement options. Saline implants are commonly chosen for submuscular placement because the muscle coverage helps hide the edges and reduces rippling, which Saline implants are more prone to show compared to silicone. Ultimately, the decision depends on your individual anatomy, aesthetic goals, and your surgeon's advice. Consulting with a board-certified plastic surgeon is essential to determine the best placement for you. They can help weigh the benefits and considerations to create the most natural, safe, and satisfying outcome tailored to your needs. Remember, every person is unique, and personalized medical guidance is always the best way to go.